Hello, I am Dr. Beena Bansal, and I have been working in Medanta for last 10 years, now moving to my new venture, Door to Care. The reason why I have started this new clinic is because over the years I have realized that medicine is really becoming more and more complex. The one example of complexity I can give is with diabetes. So for example, one generation before, medicine was all about treating infections. So a patient would go to a doctor when he would have any symptoms like pain or fever, and the doctor would give medicine which the patient will happily take because that would immediately give him relief of symptoms. But now the structure of medicine has changed. Patients do not go to doctor with any symptoms. Usually the reason why one would want to go to a doctor is to prevent complications in future. So for example, in diabetes, doctor insists, or the healthcare system insists, that patients should check their sugar levels to know if it is high. They may or may not have any symptoms, and if it is high, even without symptoms, they need to take medicines for this because that will help in prevention of complications in future. So now we see that the concept of reduction of risk of complications have come in. So and therefore there is a lot of confusion, because it is very difficult for some patients to understand why they are taking medicine, because they do not feel any immediate benefit. The perceived benefit of some of the medicines are just not there. So therefore it is important, and plus the disease is going to stay with them all throughout their life. Therefore, it is important for the patient to understand more and more about this disease and what it means to treat this disease. Why is it important to reduce the risk of complications? What is this risk reduction? Because it is all about statistical reduction of risk, which means that the doctor needs to sit with the patient and make him or her understand about the role of statistical risk reduction, the role of medications, explain about each and every medicine. So there is a huge role of communication in this whole process. Communication is not just one-sided. It's not just the doctor telling patient what to do. It's also the patient being able to open up with the doctor, because when we talk about wellness and healing, there is an important part of patient being able to convey his emotions openly to the doctor. In most diseases which I manage in endocrinology, it is important to listen to the patient, to understand what they are going through, and accordingly plan their treatment. So listening empathetically, giving patients enough time, communicating to them what this disease or the medications mean, needs time and space to have these meaningful conversations. And that is what Door to Care is all about. Door to Care aims to open a new avenue, and the aim and the vision is to have this important space and time for communication with the patient. So hoping for all the best wishes from each of you. This is Dr. Beena.